already have an egg cell, secondary oocyte is released. Now it's gonna meet up with some sperm cells in the fallopian tube, result in a fertilization. They're gonna go through, it's gonna become a zygote. They're gonna then go through all those cell divisions, make a morula as it's going down through the fallopian tube, escape out of there, going through the process of blastulation and gastrulation, giving you initially this inner cell mass, which is going to become the embryo, and these trophoblasts that will attach to that uterine lining. You'll then go through the process of gastrulation, which then will give you these primary germ layers, and that little embryo will start forming. Meanwhile, the trophoblasts are going to be releasing beta-HCG. Beta-HCG is going to circulate through your blood from that endometrium. It's going to go into those vessels. See all these arteries and veins here? It's going to go into those vessels. Meanwhile, you've got this area maintained in the ovary. Once you get that into maternal blood, that's going to circulate back to your ovary and say, hey, don't degenerate, actually hypertrophy and produce more estrogen. So this is not going to happen now. This is going to continue to be nice and rich, so that placenta that's going to be forming from these trophoblasts is going to be nice, firmly attached, and that process is going to go on for about 3 months. After 3 months, the placenta is already formed in there, and it is an endocrine organ by itself, and it will produce its own estrogens and progesterone. So you're not dependent on this anymore. And when you get this into your blood from the mother's blood, you'll certainly maintain this uterine lining, and that's going to feed back with inhibin and tell the hypothalamus, look, we've got major progesterone and estrogen levels here, don't cycle. So the hypothalamus isn't going to cycle. You don't get any changes in your reproductive system. Nothing's going to destabilize the endometrium, and now you have a very, very stable uterine lining for the remainder of that pregnancy. So the placenta is going to take over after the 3 months. Now, this beta-HCG, remember we talked about this? And we said that if you plotted this, what you get is once you have implantation, you're going to get this little rise in beta-HCG, and then that's eventually going to wane off. But once it gets out to the 3-month period, you'll max out usually around 300,000 international units. And at that point, you should have had an effect on that ovary, and now you're generating, this placenta should be generating its own estrogens and progesterone. If you have some endocrine issue and that's not happening, that's what is associated with all the problem pregnancies, and you could lose these babies. If all this is working correctly, then you don't have to worry about a thing, and you're going to have a nice, stable endometrium, a nice, functional little implantation, and pregnancy. Everybody good with this? Now, the difference here is once you max out here and you have your implantation, your levels of estrogen and progesterone are going to continue to rise as well. They're not going to drop off. They're only going to get higher. And that's what's going to feed back with inhibin to the hypothalamus. And the hypothalamus is totally checked out then because it's a positive feedback. The more you get released out of here, that's going to shut that hypothalamus off. Now, that's this growing trend. So now we have to look at what's happening in the uterus. So in the uterus, we talked about this last time a little bit. We said that what the uterus has in it is these little stretch receptors. So if you look at the uterine lining here, so this is the tubes. They've got these stretch receptors, and those are connected up to the hypothalamus. And you're not producing any oxytocin at this point. So once you get implantation and you start getting this little baby growing in there, now it's not attached to its head. Once you get this little baby growing, now the whole concept here is, all right, you've got something, the uterus does not know what's going on. It's not a smart organ, but something is expanding in that lumen, and it wants to get rid of that. So it says, all right, let's call up to the hypothalamus. That's its only thing that it can do. Get a little oxytocin, get a little contraction, maybe this will go away. But it's not going to go away because it's anchored on there. So you get a little call, a little oxytocin. Time goes by, a couple of months goes by, 3 months goes by. You get into the 4th and 5th month, and now this little baby is a lot bigger. And it's still got the placenta on there. The placenta is huge. And now it's stretching that uterus a lot more. It's going to call to the hypothalamus. A little more oxytocin. Hypothalamus gives this. You still don't feel those contractions at this point. But then you get into the later portions of pregnancy, and now you are going to start to feel those. And it's going to be periodic in months 7 through 8, depending on how you are. And then in the 9th month, this is with one little baby in there, this baby is pretty good size. It's approaching delivery time. Its maximum stretch here, say it's an 8-pound baby, which is a good sized baby. Now, the uterus is stretching, it's screaming for oxytocin, and now the hypothalamus is going to give you that oxytocin. When you get that oxytocin released, now you're going to get the cervix start to dilate. You're going to get these uterine contractions, and you will feel them. As you get closer to that delivery date, the frequency of those contractions is going to start to increase, finally culminating, if everything goes well, with the ejection of this little baby out of that uterus and the placenta following shortly after that. And then the uterus instantaneously is going to get a lot smaller by not having that mass in there. It's still, you might feel a contraction or two, and it's going to take a little bit of time for the hypothalamus to stop producing that. So you get that for a little bit. That little bit then, remember we talked about the effect of oxytocin. One of them is that pair bonding situation, and you get that with your baby. You get that for free. Meanwhile, as this uterus starts retracting on itself, it's now calling for less oxytocin. As it calls for less, it's going to take a period of time where it's not going to call for any, and then you're not going to have any oxytocin anymore. So, what you also will trigger off then in the hypothalamus once you get pregnant is the release of prolactin, which will help you then go through the secondary changes of the breast and make that a milk-producing structure. And that happens actually just before pregnancy, so you wind up having the ability to feed right away. How about that?